Thank you, Secretary Sebelius. I think, I think I was just edited by the Secretary of Health and Human Services. I've been calling it latent data, and she improved it. She's calling it lazy data, which is even better. So, lazy data from now on. That's what we're calling it. But it's not lazy because we're putting it to work. So now we're going to move into the Action Beats session of the day. And this is when we get the chance to have some news announcements on amazing new health and data technologies that are coming out. The first one today is going to be, we're going to have Glenn Paulson, the science advisor to the EPA administrator, and also Linda Birnbaum, the director of the National Institute of Environmental Health Sciences at the NIH. Please come on stage.
Good morning, everyone.
Good morning.
I'm pleased to be here on behalf of the EPA. We are delighted to be partnering with the Department of Health and Human Services in announcing the My Air, My Health Challenge. We're calling on problem solvers from across America to bring the combination of portable air sensors and portable health sensors together, using this combination to create a new perspective on how air pollution affects our well-being. This challenge is EPA's next step toward giving decision makers at every level, including communities, physicians, schools, parents, and others, a more accurate picture of the air around us and its impact on our lives. As you know, EPA is charged with protecting both the public's health and the environment. This challenge will add a completely new dimension by bringing us a better scientific understanding to make that protection more effective. Ultimately, the My Air, My Health Challenge can give everyone more accurate insights to protect our health, especially those most vulnerable to air pollution. With support from crowdsourcing firms Innocentive and Health 2.0, we're calling on interdisciplinary teams, including code developers, environmental scientists, sensor experts, and health professionals, to propose innovative solutions that connect site-specific air pollution data with measures of human health. EPA, and indeed all of us, need the solutions to this challenge to meet community needs. We're looking forward to the creative solutions that your community, especially including you here at the Datapalooza conference and watching online, will propose on this project. We're thrilled to be working with HHS. We are committed to a collaboration that will move both public health and environmental protection to a new level. I would like to call on one of my favorite colleagues, Dr. Linda Birnbaum, for a few words.
Well, good morning, everybody, and thank you, Tom and Glenn. I really am honored to be here this morning representing the National Institute of Environmental Health Sciences, one of the institutes of the National Institute of Health, and the Department of Health and Human Services in announcing the My Air, My Health Challenge. This partnership is an exciting new opportunity to advance the NIEHS mission to discover how the environment affects our health. If we can detect what a person is exposed to in the environment and measure how their body responds, we can begin to understand how to prevent certain diseases. I think we all know that Grandma said an ounce of prevention is worth a pound of cures. Our goal is to discover how we can change our environment to decrease our chances of developing diseases, because the only thing better than curing is preventing it from occurring in the first place. And we are all about helping people live healthier lives. For this challenge, we're focusing on the link between air pollution and cardiovascular health. And we are inviting all of you to help us find creative and innovative ways to understand this better. As my colleague Glenn indicated, we want the challenge to bring together teams of tech-savvy innovators with health researchers to create a personable, wearable sensor that can assess air pollution exposure while also monitoring heart rate and respiration, for example. We're looking for the capacity to monitor both environment and health indicators in real time and with spatial resolution. So this is a challenge with 2 phases. In phase 1, you'll form a team and develop a proposal that will describe your technologies and justify the linkages that you will make between exposure and physiological changes. The phase 1 proposals will be reviewed by a panel of experts, and up to 4 finalists will be selected. Each team of finalists will receive $15,000 for their outstanding contributions. During phase 2, these 4 teams will work to develop and test their proposed technologies. Judging of the 4 finalists will give us 1 challenge winner who will receive the $100,000 prize. We're really excited to be part of this, and the fact that it's collaborative is even better. We look forward to seeing all of the really cool and innovative ideas you come up with. So please visit challenge.gov to register for the competition, and good luck to every one of you. Once again, let me thank Tom and the organizers of the Datapalooza for allowing us the opportunity to announce the My Air, My Health Challenge this morning. Thank you.
So that's a really big deal. So my radar goes off when I hear something like that, because that's combining the idea of having sensors, personal sensors, combining personal data with institutional data, with population data, with organizational data. That's where a huge amount of stuff happens. So that's an exciting thing.